Meet Sam. Sam is a 22-year-old female who graduated from Dalhousie University in May of 2018. Following graduation, Sam was informed she was not accepted into the School of Occupational Therapy, which she applied for in January. Although Sam has always been a relatively anxious person, ever since she received her rejection letter, she has had an increase in her anxiety, which has made it especially difficult to participate in her activities of daily living.
As she does not have her own space because she lives at home, Sam has become increasingly irritated with her parents and younger brother and snaps at them unnecessarily. She has also developed a disinterest in eating as she finds herself feeling nauseous due to newly developed food intolerances.
Following graduation, Sam has also found it increasingly difficult to fall asleep at night and is avoiding social outings with her friends because she feels self-conscious about her future when most of her friends are talking about their new plans for the fall. Sam used to participate in yoga, but cannot enjoy it now as she is restless and consequently finds it difficult to turn off her thoughts and fully relax.
Lastly, as Sam prepares to start her summer job at the YMCA summer camp, she has become excessively worried about caring for the children and keeping them safe.
Sam's primary occupational performance issues are her inability to sleep, not attending yoga, avoidance of social situations with her friends, and not having employment figured out for the fall.
Sam's occupational goals are: within 1 month, Sam will be sleeping at least 6 hours a night, 7 days a week. Within 1 month, Sam will be regularly attending her weekly 1-hour yoga session every Wednesday. Within 2 weeks, Sam will be regularly socializing with friends once a week for at least 1 hour. And within 2 months, Sam will have applied for 3 jobs for the fall. Sam has been referred to an occupational therapist and is completing the GAD-7.
Let's see what happens.
So, what is this tool?
The Generalized Anxiety Disorder 7-item scale, GAD-7 scale, is used for screening, measuring severity, and used as part of the diagnostic process of generalized anxiety disorder. GAD is characterized by having consistent and persistent worrying thoughts, feeling restless, muscle tension, fatigue, irritability, and difficulty sleeping.
It is important to note that scores from the GAD-7 scale should not be a singular factor in diagnosing generalized anxiety disorder. Further clinical assessment should follow this tool.
The scale is a self-reported questionnaire consisting of 7 items in which individuals score their response to the item as a 0, 1, 2, or 3. This measure is intended for anyone in the general population who may be or is living with generalized anxiety disorder.
However, it's important to note the GAD-7 was created based on DSM-4 criteria of general anxiety disorder. Not everyone globally uses the DSM. Some places use the ICD. And we have since changed to the DSM-5, which has slightly different diagnostic criteria than the DSM-4.
Sounds great, but where can we access it?
Great question. The GAD-7 can be accessed online for free. The copyright is held by Pfizer Incorporated, but no permission is required to reproduce, translate, display, or distribute the questionnaire.
Which theories or models inform the development of this assessment, though?
This assessment was developed by referring to the DSM-4 symptom criteria for GAD, as well as previously existing anxiety scales. As the DSM is created by a steering committee, including psychiatrists and psychologists, it is informed by biopsychosocial theories and is very person-focused.
Initially, it consisted of 13 items, 9 items that reflected DSM-4 GAD symptoms, and 4 items that came from the review of existing anxiety scales. These items were tested on a large patient sample to rank order the best items for the final version of the questionnaire. The final version consists of the 7 items that had the highest correlation with the total score of the 13-item scale. The 7-item version was shown to be as good as the 13-item scale.
Okay, it sounds like a really useful tool, but how do we use it? How is it administered? How do we score it?
An individual being screened for generalized anxiety disorder may be referred by their physician, psychiatrist, or other healthcare professional to use the GAD-7. This is a self-reported measure, meaning the client can perform the GAD-7 anywhere they feel comfortable. This may be in a counselor's or a doctor's office, in a waiting room prior to or after a session with their clinician, or in the comfort of their own home. The counselor or clinician can also read out the prompts and can even be completed over the phone, with the clinician reading out the 7 prompts for the client and having them read the response.
The client will start by reading each of the 7 scenarios and then rating them on a scale of 0, 1, 2, or 3, correlating with how often they have felt these symptoms within the past 2 weeks. Indicating 0 for a question means not at all, 1 would mean several days, 2 would mean more than half the days, and indicating a 3 would mean nearly every day. The client picks the number that most accurately describes their feelings towards each of the 7 prompts.
The prompts are as follows: feeling nervous, anxious, or on edge, not being able to stop or control worrying, worrying too much about different things, trouble relaxing, being so restless that it is hard to sit still, becoming easily annoyed or irritable, feeling afraid as if something awful might happen.
After completion of the screening, a clinician will interpret the results by adding up the total of the numbers from each of the 7 prompts. A final question is asked by the clinician, which is as follows: if you checked any problems, how difficult have they made it for you to do your work, take care of your things at home, or get along with other people?
The total score from the GAD-7 will range from 0 to 21, and a clinician will categorize the results as follows: 0 to 4 is minimal anxiety, 5 to 9, mild anxiety, 10 to 14 is moderate anxiety, and 15 to 21 is categorized as severe anxiety.
Okay, so what does this tool mean for occupation, and how can it inform treatment planning?
The 7 main questions of the assessment do not directly relate to occupation. However, there is a final question with no implication on scoring that states if you checked off any problems, how difficult have these problems made it for you to do your work, take care of things at home, or get along with other people, with a scale ranging from not difficult at all to extremely difficult. When using this assessment as occupational therapists, it's important to find a GAD-7 template that includes this final question, as not all of them do. This question opens the conversation with the client about whether or not their experience of anxiety is affecting their occupations, broken down into self-care, productivity, and leisure. And it is a natural segue into inquiring what, if any, occupations may have been affected in their day-to-day life.
When using the GAD-7, it is important to remember that it is not to be used for diagnosis. When assessing the findings of the GAD-7, a moderate 10 to 14 points or high 15 to 21 points severity score are signs that further assessment into GAD should be done.
The GAD-7 is best used in tracking treatment progress by routinely asking the client to complete the assessment. This routine check-in can be used to guide treatment decisions, notify in the case of lack of progress, and help in identifying potential intervention targets. Some potential treatment interventions to elevated responses on specific items include diaphragmatic breathing, thought monitoring, guided imagery, challenging maladaptive thoughts and feelings, and progressive muscle relaxation. From an occupational perspective, tracking the answers to the last unscored question can allow an avenue to identify occupational performance issues and set and update SMART goals based on around the answer.
So what did Sam score on the test? What does that mean for her? And what does that mean for us as OTs when we're helping her?
Based on the interpretations of the findings and the fact that Sam circled very difficult in regards to her ability to do work and daily activities, her occupations have been impacted, likely directly by her increased anxiety. Sam indicated she's been constantly worrying nearly every day. She has anxious and nervous feelings over half the days and has no ability to control these worries. This is likely the cause for her being unable to keep focus on her daily tasks, as well as fall asleep at night, which is causing her to not get enough rest. This, combined with the fact that Sam has trouble relaxing over half the days and is often restless, and this is likely the main cause for her being unable to enjoy meaningful activities that she used to participate in, like yoga. Sam is also annoyed or easily irritated nearly every day, which is causing a strain in her family dynamic and relationships with her home and social environments. Lastly, Sam often finds herself ruminating over what awful things might happen, particularly at work where she looks after small children, which seems to be impeding her ability to concentrate and enjoy the work experience and to do it to her fullest. Considering the fact that Sam has persistent worries, is highly irritated, has trouble relaxing, is on edge, and often feels afraid something awful might happen, we need to consider what treatment options would be best suited for Sam. The aim of her treatment should be to control her worries, provide adequate relaxation techniques where she can teach herself to relax during stressful times, and cognitive restructuring with behavior modification, so Sam can learn how to control her responses when she gets irritated with her family. Possible psychotherapy should be implemented to help Sam with her thoughts. Options for consideration could include cognitive behavioral therapy or mindfulness techniques. These therapies could be of use for Sam because CBT has been shown to be effective in cognitive restructuring, worry exposure, and behavior modification. Mindfulness would also allow Sam to practice relaxation techniques to calm her mind in order for her to focus on her daily tasks and participate in meaningful activities. It's important to consider her well-being throughout these interventions. Since she experiences increased anxiety in most aspects of her daily life, we should work to ensure that the proposed interventions don't exacerbate her worries and anxieties. We would have to do more to find out exactly what aspects of some of her daily or desired occupations make her the most anxious, and be sure to propose interventions that work for her. For example, we might want to consider how much she feels anxious or irritable around other people when suggesting group versus individual therapy.
Okay, so why is this assessment good? What are its advantages?
This tool has a lot of advantages. The GAD-7 is efficient as it is brief and easy to use by clients. It has been translated into multiple languages, it is free to access, and it has demonstrated strong psychometric properties. Researchers in 2006 tested the psychometric properties and found evidence of high levels of reliability and validity. Here's an overview of a few psychometric properties.
In terms of reliability, the internal consistency was found to be excellent, and the test-retest reliability was good. Validity. Construct validity was good, as shown by expected associations found between GAD-7 scores and scores on a scale of functional status, self-reported disability days, and physician visits. A strong association was found between increasing GAD-7 severity scores and worsening functional status on all 6 dimensions of the Medical Outcomes Study Short-Form General Health Survey. Increasing anxiety severity on the GAD-7 was also associated with an increase in disability days, healthcare use, and symptom-related difficulties in activities and relationships. Convergent validity was demonstrated by a relatively strong correlation with scores from the Beck Anxiety Inventory and the Anxiety Subscale of the Symptom Checklist 90, as would be expected. Moreover, scores from the GAD-7 strongly correlated with a measure of depression done by the Primary Care Evaluation of Mental Disorders 8-item patient health questionnaire. This is consistent with research that shows that there is a high comorbidity between anxiety and depression. Divergent validity was also found to be good, as factor analysis confirmed GAD and depression to be distinct dimensions. Criterion validity was also strong, as GAD-7 scores aligned with diagnoses from interviews by mental health professionals using the DSM-4. Sensitivity was 89%, meaning 89% of patients with diagnosed GAD had a GAD-7 score of 10 or greater. And specificity was 82%, meaning 82% of patients without diagnosed GAD had a score of lower than 10. Procedural validity was also good, as there was a 0.83 correlation between scores derived from a self-report version and the same version administered by a mental health professional.
So this all sounds really good. There must be some disadvantages.
You're right, no assessment is perfect. The GAD-7 focuses on only one anxiety disorder, so other types, such as social phobia and post-traumatic stress disorder, may also need to be assessed separately. It provides only probable diagnoses, so further evaluation is necessary, and further studies needed to determine the responsiveness to change over time in treatment samples.
Additionally, it was designed using symptom criteria from the DSM-4, and the latest version of the DSM is the DSM-5, which has slightly different symptom criteria for GAD. This means that the GAD-7 is not reflective of these minor updates. It's also important to consider that since the test is based on DSM criteria, and some countries primarily use the ICD, which has a different diagnosis for GAD, there may be some differences in results interpretation in those contexts.
So you mentioned it was based on the DSM, right? So what are the theories that underlie this assessment? And what assumptions are being made? And how can that impact our treatment planning?
Right. So the GAD-7 is based on DSM criteria for GAD, and there are lots of theories that underlie the DSM. The main one is a medical model of illness and disability, namely that illness and disability occur within the person and that they should be fixed. There is often a sometimes unconscious idea that there is something wrong with the person. This is in contrast to the social model of disability and illness, which positions the person as a part of an environment, whether physical, social, cultural, or institutional, and that their symptoms or experiences may be created by that environment and that they are not inherently wrong or need to be fixed.
The medical model-based assumptions made in the DSM and the GAD-7 impact how we interpret results, as they don't encourage us to question what might be happening in Sam's life to make her anxious. For example, she reports that she feels extremely anxious about the safety of the children she lifeguards at work. With the GAD-7, we are not prompted to consider that maybe there's a good reason she feels this way, as perhaps the pool is unsafe for children. The assumption is made that her worries are excessive and abnormal, and potential symptoms of GAD, when they may in fact be a perfectly normal reaction to what's going on in her life at the moment.
When working with assessments based on the medical model of disability and illness, it's essential to work to better understand what else is going on in our client's life and environment and how that may be affecting their well-being.
So what I'm hearing is there's definitely some things to keep in mind when using this assessment, but overall it sounds pretty useful.
In conclusion, the GAD-7 scale has great reliability and validity when it comes to its use. It is easy to follow and quick to fill out, but it should be noted that as a screening tool, it is not meant to diagnose GAD. Following referral from a physician, psychiatrist, or other healthcare professional, the scale can be used in a variety of contexts chosen by the client.
If the score exceeds 10, further assessment and possible treatment should be considered. It's also essential to pair this assessment with other tools, like the CMAP-E, to better understand what is going on for your client.
We hope that you enjoyed learning about the GAD-7 and that you now better understand when it is useful to use with your clients. Happy assessing!